This is our tortoise positioning system for manual pronation. It comes with 2 positioning pads, one for the face, one for the body. Comes with the big positioning system. There's a little pad and a big pad. The little pad is like the mover and shaker. This is the one that you use to help actually turn the patient, and this is the one that lays under them. It has a spine on it. In this system, there's little air pockets, so you can't really roll it, because then all you're doing is pushing the air to one side, and it makes it nearly impossible to roll him over it. So you just scrunch it, and then so you guys would turn him. We'll turn him towards you. Okay. You come towards us. Ooh, I just got shot. And it's never perfect, so you can kind of adjust. Underneath, you want to make sure his spine is on the spine, and you want to make sure this top part is at his shoulder length. A little bit, yeah. The mover and shaker underneath him, just like we did with this. So you guys pull him towards you.
This one slides good.
Yeah, this one slides a lot easier.
I'm not grabbing her butt.
Although you grabbed mine.
I did.
You're robbing him right now. Okay. So with this, it slides really easily. You have him on a ventilator. So whenever you're turning a patient who's manually proning, you want to make it easier for the ventilator and the tubes. So you always want to turn them towards the ventilator, so it's less for them to travel. So what we would do is we're going to take, on this side, we're going to take this, and we're going to pull him to us while they pull the bottom, and they're going to want to expose the spine to them so we have something to flip it on. So we're both pulling them apart so he has something to flip onto. So you ready? 1, 2, 3. So the spine is exposed, and now we're going to put his sternum, and we're going to flip him onto this. And we would stop right here. We would switch over his electrodes from the front because we don't want him laying on those. We would put them on the back, so he's going to be off the monitor for a second. You want to make sure the patient's tolerating everything. The RT is up at the head of the bed, making sure that the airway stays secure and the lines are all secure. So we switch everything over. He's tolerating it okay. And now we would finish the rest of this. We'd finish pulling this, and he gets flopped right onto this spine. It's not perfect. Again, you're going to have to fuss a little bit with his arms, and you may have to adjust him a little bit onto this, but that's okay. That's normal. You want to make sure his arms are in swimmer's position and the head is turned. You can use the positioners to help with that. You can put this underneath. You want to make sure you offload the ear, the nose, and different parts of the body so that they are reducing pressure. And then every 2 hours you switch arm and head position if possible, because then it would freeze the joints in place otherwise. Then you want to take your mover and shaker. You want to put this underneath everything. So they're going to pull him a little bit towards them. We slide this underneath. We pull.
Sorry.
And what this does is the little mover and shaker pad has air in it. This has air in it. Them together give you a nice offloaded chest, and it allows for the chest expansion to happen a little better. But you want to see there's these red handles and these red handles. Red goes in red, and you lock them together so that if you have to move him up and adjust him in the bed, everything stays as one. And you can tuck it if you want. Tucking it helps just give him a little more air cushion and offload all the bony prominences. And then this part is really important too. There's a little, it's kind of rough, and it prevents him from sliding down. So if you don't tuck this is the tail. If you don't tuck this, he may slide down in the bed. So we would do it together, 1, 2, 3, and you tuck it under, and then you would offload the heels, and then this prevents him from sliding.
That thing.
That thing can be used to, like a pillow. You can use that or pillows to, if the doctor orders turning Q2 along with the positioning arms, you can offload and put this or a pillow underneath one side and kind of tilt them a little bit.
You can do either side.
You can do it. Just depends on what patient can tolerate, and what maybe he has a white out lung on one side, so they can't tolerate being down. So be supine to one side, supine to one side, or if they can tolerate, they can do both. But for the most part, sometimes physicians only order prone or supine. They don't always. You don't always. The patient's not stable enough to turn side to side. But this is like a pillow, or you can use a pillow, whatever works best for the patient. It's just a little positioner for the body. You can, but I don't put it on during the turning process because it's just one more thing you have to worry about. If you want to put a Covidian to protect this, or if there's a lot of secretions, you can totally put one down, but I would just wait till after you're turning because it's one more thing that gets all wonky and everything. All right, so what we have to do is untuck this, and then you're going to want to remove the red handles, unattach the red handles, and we're going to want to take the little pad out, and we're going to use that again as our mover and shaker to actually do the turning. So do you guys want to pull? Yeah.
Stop it right here.
And then you can just pull it right out. It slides out really easily. And now we're going to actually put this underneath him. So we'll pull him towards us.
Also put that on our swimmers.
Yes, and you want to make sure both arms come down so it's like a little torpedo and easier to turn. Oh, we have to untuck the tail. There we go. We're going to go closest to the vent away. So the smallest distance that you travel away from the vent. So you guys are going to pull him, and they're going to pull him that way, and now we are going to pull the bottom and expose the spine because that's where he's going to travel to. Okay, ready? 1, 2, 3. So you can see the spine here, and again his spine, his spine is we're gonna flip him onto this. So we're gonna start turning him halfway. We would switch his leads again, make sure he's tolerating it and hemodynamically stable, and the RT is making sure the airway is secure. When we finish turning him, and he's kind of on this, but sometimes you have to adjust him a little bit. Pull the whole thing. Perfect. And you can also put this underneath if you want, again, to offload with air, but you don't have to. And then you would want to tuck these, position him appropriately, and then set the tail in again so he doesn't slide down.
So here's some visual cues for how to cushion the bony prominences. And sometimes you don't have the exact shapes that you need, and just improvise.